For my science project, I decided to do a collapsed lung, also known as pneumothorax, which is the scientific term given for a collapsed lung. The reason I chose this injury was because there's a couple athletes that have gotten it, and it's been crazy stories about how they've gotten it. And also, I feel like it's an injury not talked about that often. And I found it interesting to learn about just how one lung can affect the entire body in a huge way. And also, I think the ways that you have to heal or the surgeries you have to get to get your lung back to normal is very interesting. So many people might be wondering, what is a collapsed lung? Scientifically, the definition is a collapsed lung, also known as pneumothorax, is a condition that occurs when air enters the space between the chest wall and the lung. As the air builds up, the pressure inside the pleural space increases and causes the lung to collapse. The pressure also prevents the lung from expanding when you try to inhale, causing chest pain and shortness of breath. So I think this X-ray to the right perfectly shows what a collapsed lung is. If you look to the left, you can see that that's a healthy lung. There's no problems with it. It's fully expandable. It looks good. And then to the right, we see a lung that's only 2/3 of the size a lung should actually be. And if we look closely, right near the rib cage, you can see a white area. That's air that's filling up between the chest wall and the lung and causing the lung to not be able to expand fully. And these are some ways you can actually obtain a collapsed lung. Some common way, some common ways most people get it is a gunshot, a knife, or someone stabbing you, a wound to the chest, a rib fracture, and then in some cases, crazy cases, you can have certain medical procedures. In the coming slides, I'm going to tell you about one medical procedure that actually punctured a lung, which then collapsed. And then also, you can have some lung diseases that increase your chances of getting a collapsed lung. The most common one is asthma. Another one is cystic fibrosis, tuberculosis, whooping cough, and chronic obstructive pulmonary disease, also known as COPD. The picture to the right is just two healthy looking lungs. So right here I have listed a few of the different types of collapsed lungs you can have. The first one is the primary spontaneous pneumothorax. The second one is the secondary spontaneous pneumothorax. And the third one is the injury-related pneumothorax. Many of you guys are probably questioning, what's the difference between them? So the primary spontaneous pneumothorax is when the collapsed lung happens without any pre-existing lung conditions. So that can happen when you don't have any asthma, you don't have whooping cough, anything like that. There's no prior knowledge that your lungs are not in a good state or can be affected. Secondary spontaneous pneumothorax is when you have asthma, whooping cough, tuberculosis, something along those lines that can affect your lungs and put you at a higher risk of having a collapsed lung. And injury-related pneumothorax is kind of a gunshot wound, a stab wound, something that you get injured not from a pre-existing health condition. Now, here are ways to repair your lung. There's surgery that removes blebs of areas of scarring or attaches the lung permanently to the chest wall. There's a chemical injection that you can have that brings the lung and the chest wall together. It's called pleurodesis. Then you can have a surgery which sticks basically a needle and a syringe into your lung, and it sucks the excess air out of your chest wall and allows your lung to re-expand. And then on rare occasions, it can just heal over time, but it's not going to be a quick minute thing. It takes a couple of days, and then your lung will finally expand fully. And to the right, the picture I showed is the surgical removing of air. That's when you can see on the picture to the left, they stick in a needle into the left lung, which has all that excess air, and they're gonna pump it out. And then to the right, they take the needle out. They got all the air out, and the lung is back to normal, looking good. So the system of the bodies that a collapsed lung affects. Obviously, the most obvious one is the respiratory system. You're gonna have shortness of breath. You're gonna have chest pains, which is gonna make it harder for you to breathe. So that's the respiratory system. And then another one is the cardiovascular system. And for your blood in your bloodstream, you need oxygen. And if you have a collapsed lung, you're not producing as much oxygen as your blood needs. And that can affect your heart, which needs oxygen. And without oxygen and other nutrients that are made through breathing, you're at a very high risk of your heart not working correctly, and then your rest of your body basically breaks down when your lungs not working correctly. And yes, you can live with one lung, so I mean, I guess you could take out your lung. So this is the cost of the procedure, and so the median cost of treatment with the conventional intercostal chest tube drainage was $6,160. 95% of these surgeries cost between 3,100 and 14,270 US dollars, and $500 for when the treatment was performed with a thoracic vent. So basically, the more expensive one, that's when you have to go to the hospital, you have to get surgery, you're going to have the tube injected into you, it's going to be pumping out air, and that's like a medical procedure. The thoracic vent is something that they'll have in ambulances most of the time, and if it's injected into you, it'll just drain all the air out, and hopefully your lung just expands without needing you to go get surgery and etc. It's just usually they stab it in you. Hopefully it just drains out all the air, your lung expands, and all you need is stitches. The left lung, the red lung, is the healthy lung. As you can see, it has the shape of a healthy lung. And the collapsed lung is the black balloon. As you can see, it's extremely deflated. It's not on the chest wall, which is the mason jar. The glass is acting as the chest wall. The black is off of it, so there's air in between the wall and the lung, causing it not to expand fully. And then in the back, if you look, you can see some white painting. That was me trying to paint rib cages, which usually surround your chest wall. I didn't want to do the full rib cage because I wanted you to have an unobstructed view of what the lungs look like in a 3D model. Right here, I have the chances that you have another collapsed lung, and also what are the long-term effects. So your long-term outlook depends on the size of the pneumothorax, as well as the cause and treatment required. A small pneumothorax doesn't have significant symptoms and can be resolved with observation or minimal treatment. When you have a large pneumothorax, that can result in trauma and can affect both the lungs, and you're going to need a lot more serious medication or treatment or even surgery. And then a pneumothorax that continues often can be more challenging to treat. And also, or the more collapsed lungs you have, the more likely you're going to be to have another one, whether that you have an underlying illness or disease that causes you to have weak lungs. There's a lot of different things, but if you have a collapsed lung, you're more likely to have another one, depending on the size. But the smaller, you're good. The bigger, you're likely going to have another one. After seeing this presentation, you might wonder, oh, what are some future risks that could cause me to have a collapsed lungs? Well, here are some. Smoking. The more cigarettes you smoke or vaping now, that can weaken your lungs, and as you can see in the pictures, you can get popcorn lungs or your lungs just turn black. That makes it makes your lungs a lot weaker and you become a lot more likely to have a collapsed lungs. Another one is something you can't control, which is genetics. And certain types of pneumothorax appear to run in the family. So if one of your family members has a history of having collapsed lungs, it's likely that you have that gene, and that increases your likelihood of unfortunately getting a collapsed lung. Another another way is lung disease. So if you have a lung disease, obviously you're a lot more likely your lungs aren't as strong. And like I said earlier in the presentation, one of those diseases that causes pneumothorax or collapsed lung more often is chronic obstructive pulmonary disease, COPD, and then medical or mechanical ventilation. Obviously, you have a disease or something along those lines if you need ventilation to help you breathe, and obviously that's going to cause your lungs aren't as strong as they probably should be, and you're at higher risk. And then, like I said in the prior slide, previous pneumothorax. If you've had pneumothorax before, you're at an increased risk to have another. And finally, we have a famous athlete story. As you can see to the right, this is Tyrod Taylor. He's a quarterback for the now Los Angeles Chargers. This was taken 5 minutes before he suffered a punctured lung, which resulted in his lung collapsing. So basically, he was having some back pains and some pain, so a doctor decided to give him a lethal and not or an injection to help minimize those pains. And unfortunately, it punctured his lung just like a stab wound or a bullet, and that caused his lungs to collapse, which thankfully it wasn't life threatening. He was brought to the hospital, but he ended up fine. He's still playing football, but that basically ruined it was the week one. He was going to be the starter, and then Justin Herbert came along and basically took Tyrod Taylor's job away, but thankfully Tyrod Taylor's all right. He's healthy. He's on a different team fighting for starting QB spot. He has no hard feelings against the doctor. He said it was a mistake. He understands it. And the NFL actually is investigating the doctor, and only time will tell what really happened.